Now we'll be talking about stable angina pectoris, or in short, angina. Now it is called pectoris because we know that the pectoralis muscles are present over the chest. So whenever we label it as angina, we are referring for chest pain. And most of the time, we always think of heart-related pain because any patient having chest pain may not at all have heart related pain. It can be muscle related pain, bone related pain, lungs related pain, pleural related pain. So it can be anything else, but most worried or most fearsome is chest pain because of the heart attack or heart related pain. So why do the patient have this chest pain? It is because the when we talk about heart related pain, chest pain, it is always because of transient myocardial or transient poor blood flow to the heart muscle, which releases the substance P or histamine or serotonin or the other biochemicals at the site of ischemia around the heart muscle, which causes the chest pain. Now, how do we define angina pectoris is this is defined these are the episodes of chest discomfort, which is usually described as heaviness or pressure. The patient may say that there has been significantly pressure on the chest, or there is maybe a large stone which is placed on the chest, and it may feel as a very much heaviness on the chest, or the patient may say that this type of discomfort is like that they are feeling like their chest is getting squeezed by the pressure. It can be also felt as a smothering or choking type of sensation. Many of the time patient may say that they have the shortness of breath or palpitation, and the patient may typically have sweating also whenever these patients do have chest pain. Now, this patient very typically places their hand over a squeezed hand or fist over the sternum, and mostly it can be like a fist to indicate that they have very much squeezing over the chest, which is usually central, and the squeezing or the chest pain is usually present below the sternal area, and this is very typically called Levine sign. One thing is for sure that this chest pain is usually very much constant, but the intensity of the pain is very commonly increasing and decreasing. So the chest pain increase and decrease, increase and decrease, increase and decrease, which we call it as crescendo decrescendo pattern, that is increasing and decreasing in intensity. This chest pain usually always lasts for 2 to 5 minutes because this is a stable angina. Whenever we are referring a pain as unstable angina, then this pain will last for more than 10 minutes. But in stable angina, it always typically lasts for 2 to 5 minutes, and it can very commonly radiate to either any of the extremity, right or left upper extremity. It can also radiate to jaw, and it is very rarely seen below epigastric region. The radiation to the back is common, interscapular region is common, towards the root of neck, jaw, teeth is very common, and up to epigastric is common. This radiation of the pain is can be common. It's not compulsory to have this radiation, but the patient may have radiation of the pain toward these areas. Now, when we are referring this to a stable, it means that this angina typically always occurs at exertion. Because if it is not occurring at exertion, if it is occurring at rest, then this won't be called stable angina, then it will be called as unstable angina. So this stable angina is not there at rest. It always comes with exertion like exercise or hurrying or during sexual activities or whenever the patient is stressed, like whenever the patient is in quarrels or whenever the patient is angry or frightened, then these patients will have this chest pain. But it usually gets better at rest, or it usually gets better with tablet sorbitrate. One of the most common thing which is very commonly seen is this chest pain can worsen markedly with heavy meal. Now, why is that? Because we know these patients have this pain because of the transient myocardial ischemia. So whenever they take food, automatically the gut, like stomach, small intestine, large intestine, they have to give more blood flow. Why is that? Because they need to digest the food, they need to assimilate the food. So whenever there is heavy diet or whenever they take large amount of food, automatically the blood flow has to be increased to gut. Now, from where this blood is going to come? Obviously, the blood is going to get shuttled from other vital organs or from the like muscles. So automatically the blood flow which the heart gets will be slightly reduced. That is the reason why this transient myocardial ischemia can worsen and the chest pain may worsen. In the cold, obviously, the muscle blood flow is increased to keep the temperature higher. So automatically the heart gets kind of lesser blood flow and the transient myocardial ischemia may again worsen. This exertional angina in stable angina usually gets always relieved within 1 to 5 minutes after slowing down or waiting, resting, and more rapidly with the sublingual nitroglycerin tablet. This is the reason why it is called stable. If this chest pain doesn't get better within 5 to 10 minutes, then won't be called as stable, but instead it will be called as unstable angina if it is not myocardial infarction. It occurs very frequently in winter because as I told, cold increases the blood flow to the muscles. So transiently or for a particular time, the blood flow towards the heart is reduced. So automatically this ischemia worsens in winter or cold seasons. Now, each and every patient may not complain angina as a chest pain only. The patient may say that they get episodically some episodes of nausea or episodes of fatigue or episodes of faintness or episode of shortness of breath or palpitation whenever they start doing some physical activity or during exertion. So this may not be angina, but it is angina only, and we label this as angina equivalent. And this is very typically commonly seen in patients who are elderly or those patients who have diabetes. Those patients whose first degree relative male patients are less than 55 years of age and less than 65 years of age in female relatives, and presence of this diabetes, presence of this dyslipidemia, presence of hypertension, smoking. These are very bad risk factors for this angina, and these patients do have very repeated attacks of angina and they may worsen if they are not properly treated. So, presence of advanced age, male sex, post-menopausal state, and the risk factors like these diabetes, hypertriglyceridemia, or abnormally high LDL or low HDL, hypertension, smoking, alcoholism, bad lifestyles, poor sleep, stress. These are all the risk factors which puts the patient to significant coronary artery disease pathology, and these patients may have the typical stable angina, which, if it is not properly treated, may land up in unstable angina. So for now, this is all. We'll come with the next topic or the stable angina, details of the treatment and investigation. Thank you.